so my background's nursing, so I was thinking about how the standards fit with the code of practice, and I think all the registration bodies have looked really closely at the codes of practice that they're issuing and how that fits into the kind of modern kind of integrated world and how we all work together in relation to supporting people. And certainly from my perspective, I feel that the most recent code of practice for nursing is actually much closer to what I do working in a social care environment and in the community, because before it didn't feel as though it related as well to the work that I'm doing, whereas my sense is it's all coming together now, and that the standards and the code itself actually feel like quite a good fit. And I think historically that maybe didn't feel as good. You know, you were trying to work out, you know, what it all meant and how it fit together and how you could, you know, so for instance when you're doing your re-registering, doing your revalidation, etc., how do you make what you're doing fit into that? I feel as though sitting alongside my social work colleagues, you know, people that are registered with SSSC and social work qualifications, and it's not, I mean, we've always worked really well together, but I feel as though everything else is catching up now, and that we're all, you know, working. We know we're all working towards the same things, but it feels now as though, in terms of our codes of practice and our registration, that's actually recognised, that, you know, that we're one workforce.
The care standards are given as an excellent description of this is what good support and good lives should look like for the people that we're providing support to, with the codes practice almost kind of defining the behaviours, the conduct that's necessary in delivering that and maintaining faith and trust in the sector. So I think from that point of view they work really well together. You know, we'll just be continually making reference to the codes, either if it's staff training that we're delivering, even the staff handbooks that are sent out to new employees before their first day of work with key, right through to any time we just need to be working with a member of staff around an area of development, for example. The codes are excellent at defining what's your behaviour, your approach that we really need. So I do think they're going to work.
One of the things I think I really like about them is, as you mentioned it, Alistair, it talks about people having confidence in the service and in the staff that when they experience support. And one of the things that we've talked about over the last few years, particularly in relation to things like self-directed support, is having a confident workforce as well. And I think having that thread running through the standards in relation to, we want people to be confident in our staff and our services, but we really want workers to have confidence in the work that they're doing and being trusted to go out and do that, and having a set of standards that they can relate to. So I think that theme of confidence running through it is really, really helpful. We're all working to our own professional bodies, we're all working to the different codes of practice, whether you're an OT, whether you're a social worker or a social care worker, whether you're a nurse, etc. And for a long time I felt as though the codes weren't really in alignment, and certainly in my own experience I didn't feel that my code as a nurse really kind of aligned as well as it maybe could with the social care role that I'm tasked with. And I just feel more recently, with the new codes being developed in the last while, and then the standards coming alongside that, it just feels as though things are beginning to align better now, that we're beginning to recognise much better that we are all trying to achieve the same things for people, and that the standards that we're working to and the codes of practice that we're all working to are actually beginning to complement each other much better. And I feel much more comfortable in my role that I'm compliant with my code of practice, the standards and principles behind my code of practice, but the care standards themselves are actually complementary to that, and that I don't feel as though there's any difference or conflict or, you know, kind of battle, I suppose, in terms of trying to make sure that when I'm evidencing my practice, that I can actually satisfy the codes and the standards within what I do without having to think separately about what that means. So I'm really a lot happier with how the standards fit into that.